solutions and work together to respect and secure animal population and sustainable animals, sustainable resources. How we need to integrate multidisciplinary knowledge on data on animal health, on human health, and environmental health to create more solid and valuable advice to decision makers and the society. A pillar in One Health is health economy. The farmer's economy is important, of course, but indeed also the economy of society. Today, both national and globally, big investments are made on animal health. However, how are these investments evaluated and how are they measured with respect to sustainable impact? How do we measure, if at all, soft values and hidden costs? Do we invest too little in animal health? Do we invest wrongly? Or do our investments give the best possible returns? Health economic aims to help understand costs and benefits and answers some of these questions. By analyzing data related to extended burden of animal diseases, mortalities, reduced productivity, and several other known and hidden costs, etc., better decisions can be made to prioritize, improve allocations of resources, and justify the amounts of resources used for animal disease prevention, disease control, and One Health. Increased understanding of the impact across the value chain and society will envisage the societal impact of these investments. How we are thinking around these issues, what tools are available, and how they can be used to achieve improved understanding and decision-making are for us to discuss and reflect on during this conference and just now during this event, and of course also in the continuation afterwards. So these are some of the things I feel that this event is about, to see how we can interact multidisciplinary to improve animal health and One Health with the tools that are available. Thank you. Good luck.
Thank you very much, Edgar, for a great introduction. And I would like now to introduce Fernanda Doria, project coordinator for the early warning system in FAO. So yeah, take the stage. Thank you.
Thank you so much, Stefano and Ben, for organizing this session. Thank you for allowing FAO to participate as well. The reason we wanted to be here is because FAO helps countries building capacity in animal health. We all know that doing surveillance and doing health is not a matter of tools. Tools are just a support. What we need is capacity at country level to collect the data and to be able to use the data. If you pass one slide there. Yeah. So this slide is a bit easy, but it's just why we believe in doing surveillance to do so tools, right? So in the middle there, you have this framework that I'm not sure how much you can read, but that FAO has put together to kind of summarize and guide countries to the capacity they should do in order to So you have there the capacity for countries to build in order to do better mitigation. So you have starting here the risk monitoring and taking this. Then you have the surveillance for inspection of diseases. And then on the side of it is disease prevention, communication, and support. So on the last is the data collection, right? And then everything you can do is that data. So FAO does support countries also with an act for collection of the data and then collation of data collected in that act to a platform. But
Do you need this one to pass this slide? Fine. Yeah, I think that was it. So, but our vision is that collecting data from disease notifications and suspicions is just one part of the story, right? To do surveillance, you need to collect a lot more data, as we saw in the introduction today, with all the, for the climate data, for instance, so all the data that you need to collate. So the family of tools that FAO is developing does have this in mind, the idea that you have a platform to collate different data sources. And we've been collaborating with DHIS2 to make sure that data that you collect through DHIS2 can be one of those sources of information, or the other way around. So the vision we believe on, if we just pass one more slide, is of a world where things are interconnected. And I'm not sure you can read the ones that I did very light, but those are the different models. These are the different models of interoperability that we believe in and that we've been working with DHIS2 to support. So whether animal health and public health are exchanging data directly, and or whether both animal health and public health are uploading to a One Health platform, whichever way the country's governance allowed to do, our mission is to support countries to do animal health well. And then for those countries that are ready for One Health, to make sure we collaborate with public health to collect the data from animal health and public health for better decisions. So that's the vision of what we're supporting. We support countries directly with animal health. And whenever we're ready for One Health, we support that connection. And that's why we're happy to be here today and to hear more about how DHIS2 is also being used for animal health. Thanks.
Thank you very much, Fernanda. So without further I will introduce Jean-Paul from East Rwanda. He's going to present about their experience of use of the DHIS2 platform for both animal health and One Health.
Thank you very much. My name is Jean-Paul Akibikimana. I'm from Rwanda, work for East Rwanda. I'm the head of implementation and capacity building, and East Rwanda is a project in 11 countries. So we are very happy to share the use case for Rwanda. I think the slides are coming. I just want to take you through these slides, but they're just divided into two parts. One is at least to give you a background of how Rwanda is organized when it comes to things like One Health, and then secondly, we'll talk about how DHIS is just being used for surveillance of this zoonotic disease. Next. Rwanda, when it comes to One Health, the surveillance is based on these three pillars: donation, collaboration, and communication. We can see how it is organized. Next. Recognizing interconnection of human health, animal, and ecosystem. That's one principle. Another one. Next. Enhancing cooperation through integration of human medicine, and environmental science. As he said, of course, when we talk about One Health, it's about human, animal, and environment. Next sectorial collaboration. When we are talking about human and animal health, that means it's just not for one sector, it's a multi-sector collaboration intervention. Next, education of the future One Health workforce, because we believe that One Health, it's just something, not a concept of today, but a continuous process of collaborating and putting together those three aspects for us to live in an environment where animals and humans they are protecting each other. Next slide, please. Next. Okay. So the vision of Rwanda, because one has this framework for One Health. So when you read it through, we find that one is to strengthen this sectorial collaboration, capacity building, education for Rwandans, especially those who are going to be part of this game going forward. And most of the main topics will be just about how to conduct this surveillance about all those problematic diseases. Next. So, this is a summarized roadmap of how Rwanda has been able to implement this One Health framework. Rwanda started by putting in place a committee, that's a commission, and then we came up with a strategic plan, and then it took time just for it to be operational, and then One Health policy. With all those steps up to the last one, I want to see the last one, which is to put in place a surveillance system, which was DHIS2 system to monitor, correct, analyze, and take decisions based on data collected from community level upwards through the reporting hierarchy using DHIS2 solution. Next, please. These are the key institutional and organizational achievements, but they are summarized in the previous slides. But you will see that for the country to strengthen the connection, the structure has been put in place up to the lowest level. But what I want just to talk about is that technical working groups from different sectors, and health, environmental, agriculture, having this technical working groups helps to disseminate the information either upwards or downwards. Next. Now, these are some of the aspects the country has been able to put in place to facilitate the connection. I want to go through it and everyone, but you will see that there is that through that connection. The country had first to have kind of guidelines, strategies, and then operationalization of it, and then surveillance, and the monitoring of the compliance using the management tools, including based in DHIS2. These are some of the examples of solutions we are using to ensure that we are monitoring the compliance, we are monitoring the reporting process, and also be able to have data capture making. Next. One was for the sector and institutional trends. The presence of an electronic surveillance reporting, which is IDS-RP, that's one of the trends. Then human and animal systems that are well centralized down to the community, because when you are talking about surveillance, that means you need to get data from the households. So through this system, a community health worker who is based at the village is the one reporting the information straight to the health facility, and then the same information is sent up to the central level, and then the central level will now disseminate the advice of how to work to manage the reported events, and then collaboration with local governments and health facilities. The community health worker will be reached so that the case can be managed in real time. I want to go through all those, and then you go to the next slide, please. Technical working groups. These are different technical working groups from different sectors that are helping us to monitor and implement this One Health strategy using data from the system. Next. Then this second part is just about how do we facilitate the country to be able to know what's happening and take decisions using the systems. DHIS2. Next. Right. So I just want to explain a bit how it's done. You see it's down there, you're having human, you're having animals, you're having wood life facilities. Those different facilities collecting data, either it can be facilities, health facilities can be clinics for animals, can be for clinics for life facilities. So once they get information, they submit the report to the IDS server. That is DHIS2 surveillance-based system, real-time system, where they submit the immediate reports. Once they submit, either through a web or through SSD, through phone, the information is same time at national and province level. And then, but also same time, that information is digested, treated, and then they will give a feedback. That feedback contains, of course, advice on how to manage, but also they will see that they will send their teams to start the investigation and they will report the process in the system. Next, please. I think that is just because I think done. It's almost clear. What just made the performance of the community worker. Or here, when we started this outbreak of One Health, usually we used to have these community workers, but now we start the Ministry of Agriculture has also introduced the community animal workers. We see we are having now community workers and animal workers. At village level, when it's something related to animals, those animal community workers are the ones to collect and send the information database, and then it will be managed the same way the information for disease is managed. Next, please. So these are some of the source of information we are getting from the feed, and it is entered into the system and treated for decision making. You will see that they are getting some samples from animals and it is entered into the system for decision making. This is one of the examples of surveillance. Next, please. This is another example of micro-resistance events. We have a component in GBADs to track this information. Next, please. Right. Also, we started this time here to show that this volunteers is not currently is not integrated in IDSR, but as you have seen in production the morning, among the 10 countries which started working on this climate and health aspect. We are still at that level of testing models, but you see that the direction is to integrate this climate component in IDSR so that you can translate data. Next. Yes, sir. I think we can take you to the page like these are the examples of this time. Next. Next. I want to go to the requirements and the changes. Right. This is a summary of terms we have been testing throughout this approach to the ministry as part of the technical group. One is that One Health is still a new topic for some of the partners. You will see that people they think that just they have to finance and deal with the health, but when it comes to One Health, it's a new aspect. And there is a need to reorganize surveillance structure because the way we used to connect this kind of surveillance, just dealing with health side, it has to be organized so that we can tackle it on the side. They need to promote resources for this One Health to be operationalized. Let's take the last slide. Yeah, some of the lessons learned, high level leadership, ownership is very key for One Health to be successful. And then One Health is only possible through a sector collaboration and coordination. Of course, funding is very needed. And when it comes to surveillance digital tools, it's not just about technology, just to put in place a solution, a technical solution. We need to think about this social and environmental aspects, because if you don't adopt this systemic thinking, you will just bring a very strong IT solution, but it is not going to have the approach you need to consider where to find disease and where to report, who is going to influence the decision, who is going to fund whatever that's needed. So it's a kind of social technical design, so just designing a technical solution and put it in place. Thank you very much.
Thank you very much, Jean-Paul, for this beautiful example of the use of DHIS2 on One Health and animal health. I will now invite Kofi from Central Africa, who's going to present a clear example of the use of DHIS2 on the West Central Africa region. Thank you very much, Kofi. Thank you so much. Hello, everyone. Finally got to the presentation.
Just have to go to the presentation. Yeah, no. You can start, please.
Just introducing myself. Kofi, I need to say that I'm the best coffee in the world. Even though I'm not drinkable, which is still need to be proved. So I'm happy to share with you the experience we have across various countries in DRC, in Togo and in Guinea, using One Health and Animal Health together in DHIS2. I would say that in general, Jean-Paul has already reminded you about what One Health is and how you can use it to use DHIS2 to kind of technologically boost One Health. So we're going to take you through. So the three experiences that we have. First, I will start with Togo. In Togo, what we have is that we do have a One Health idea, but we have no tool, no system in place. So the government decided to go for the One Health system, and they set up a technical committee for that. We were called to discuss with them, and luckily the World Bank was there with the money. So, okay, thank you so much. So, yeah, let's go to, so, you know, we think about the requirements, how One Health have integrated approaches, and why DHIS2 is an opportunity for technically operationalizing One Health in different settings. Next, please. So, as Jean-Paul mentioned earlier, the DHIS2 and One Health facilitate data sharing, introduce surveillance and good coordination, and also we in DHIS2 network, the group support the world and UIO, trying to kind of design a model, a durable model in DHIS2 for One Health. Next. So I'm talking about those two countries that we are going to work to. Next. Okay, I started by Togo. Next, and I will come back to it. So I will say that in Togo we have that committee that was put in place, and we came in. We have a series of things. The first thing that I will highlight is that we needed first to have an harmonized metadata dictionary, which was critical. It was a very tense discussion between the three sectors, and we finally arrived at having what we call 19 unusual events, a common list of 19 unusual events, and we use it, go to the system, and then we have designed a system made of several components. The first component was a joint One Health reporting tool from community health workers and from branches. So they were reporting all together live on one single joint event program.
And then we have three aggregated forms, one form for each of the sectors. And then we have some indicators. And lastly, we managed to have a one health joint bulletin that we designed in the system. The pilot is ongoing. I would say it's suspended or ongoing, something like this. It's ongoing. It was supposed to move to the next stage, scale up, but we know what happened to the funds, and we're still doing it. Let's go up to DRC. Yeah. So we know about DRC, a very wide country, 2.2 million kilometers square, if I'm not mistaken, 90 million people, and a very good biodiversity with wildlife, 9 countries, neighboring countries. So it's a very good complex, a very good, I would say, case for one health. So we there designed a system made of 2 factor programs, and we had agreed on 12 animal diseases. You can see there Ebola, mpox, you know, all these nice names. So you have all the system that allows you to track, first to do 3 things. First of all, you will notify related diseases. And secondly, you will also track animal bites. And third, you track animal vaccination, pet vaccination. So these three, this combination helps us to pilot that system in one province, Congo Central. We were up to move to the next project when what has happened. So luckily, we have been notified that they have managed to secure domestic funding to move to a second province. Next, please. So the third one is about Guinea. We in Guinea work with, you can see, Ministry of Agriculture and Livestock, and we designed a system that was connected with imprecise, but unfortunately didn't move forward due to what you know. And we have designed the system, and we still stand by to move on the optimization and to the next steps. Next slide, please. So I would say that in general, to sum up, we have some key results. The models that are running in the country, we have coordination, we have joint data visualization, and we have seen also a second level of appropriation, because on this in these countries, DHIS2 was way ahead in terms of HMIS, but in the environmental and the agricultural sector, DHIS2 was quite unknown. So they discovered it, and even in the environmental sector in total, they have now mobilized to use DHIS2 as a main information system. So you can see that it's appealing and people are embracing it, which is very good. Next, some key challenges. First of all, the institutional complexity of cross-sectoral collaboration. We need to discuss a lot, time consuming, and even when you reach something, it's fragile. You need to nurture it because it's always work in progress. These 3 sectors are at several different maturity levels. You know, you have some sectors that are still paper-based, and then you have to navigate this, I would say, this balance of, I would say, even capacities as well. A problem that we have also been dealing with is the unmatching administrative divide. You know, if you want to collect data in DHIS, you need all the units. And when you have different units in the environmental sector and then in the health sector and so on, then this is a challenge. How do you manage to have all these different units and see? So these are some of these challenges. Let me show you back to next slide. I've talked about the lesson learned, capacity, data visualization. Let me show you a few images. Yes, let's go. Yeah, that is the layout of features in Togo. In this role, we have At the right side, the WHO representative. And you have two ministers, the Minister of Environment, the Minister of Health, and the Minister of Agriculture. And then at the last, you have the World Bank representative. This is how you mobilize people around the project. Next slide, please. This is the training section, the design workshop where we have selected people working on trying to figure out which data we should use and so on. Next. These are some dashboards where you can see, this is the zoonotic coverage dashboard that we managed to design. You can see also maps and so on. Next slide. This is for, I think we can people. Let's go to the next one. Okay, this is, you have first what the contributed form for collecting unusual events in Congo, and then you have a snapshot of the two aggregated dashboards. The aggregated forms for health, animal health, environmental health, and human health. Next. So you have a dashboard for environmental health, another dashboard next for animal health as well, next for human health, next. And this is something that shows you the highlights about all the 19 unusual events that have been identified as point of surveillance. Last one. Yeah, and this also shows you a visualization of all these 19 identification resources. So that's what we wanted to share with you. Thanks.
Thank you very much, Rob. Thank you very much. And the next stage will be the representative from the GBAD, for the ones who doesn't know, means the Global Burden Animal Disease is an initiative under the University of Liverpool. So it is going to present us about the initiative and the link between animal health and economies. Thank you.
You managed to get his last name right, but it's GBADs.
GBADs.
So the Global Burden of Animal Diseases initiated in 2020 with support from the Gates Foundation and together with the World Organization for Animal Health and also the close collaboration with the Food and Agriculture Organization of the United Nations. So I'm not an economist, but I'm going to talk about economics. So rest easy, it's not going to be complicated. I'm a poultry vet and I'm program manager for this program. Too many things to hold here. Okay. All right. I also just want to recognise my colleagues, Edward and Cecilia Valdo, from the Norwegian Veterinary Institute. So within the Global Burden of Animal Diseases, we are setting up a regional basis for working. And our European Collaborating Centre for the Economics of Animal Health is shared between University of Liverpool, where I spend some of my time now, the Norwegian Veterinary Institute and Utrecht University, and our Liverpool aspect is moving on to the University of Edinburgh in the future. The director is an economist called Jonathan Rushton, who's Professor of Animal Health Economics. So that's me, isn't it? Okay, so just to frame it, the beliefs and motivations of the program, why are we doing this? Okay. So we believe livestock health is critical for ensuring human and environmental health and creating and maintaining stable livelihoods. So there are hundreds of millions of livestock people who have very poor access or no access to veterinary services and technology. And that's evidence in different countries I've recently been speaking all over the world. And with very poor information, success or even failure of animal health programs. So global society needs that information on the health of livestock. So that's why we're doing what we're doing. So, what are we actually doing? Our aim is to support business cases for investment and not total budget of the health system. Yeah. So this allows the allocation of resources to key priority animal health interventions to improve outcomes for livelihoods, businesses, environment, consumer, and animal welfare. So you got a good time out there. And also, it will assist in evaluation either before or after animal health and policies are implemented. So I want to just talk a little bit about theory to action, because I do get quite frustrated about the One Health paradigm and kind of positioning, actually turning into actionable projects. So this is my attempt at doing it. So I think we really need to move from the theory of connected food and health systems into models that describe our objectives and connectivity in a bit more detail in an actual way, and then we actually need some projects. So the reason I got into economics is because I found that in my job, working as a vet within a poultry business, is a good way to advocate to my CEO for funds into animal health, not just into the factory or the library or the country. And so that's why I'm going to hopefully impress upon you that economics has a place here. So, in terms of burden, now we're in the business here, particularly in GBADs, looking at animal health burden. But we've worked with teams who work on plant health burden. And certainly crop production has an interaction into animal health burden, and outputs in animal health or animal livestock systems feed back into crops and plant health burden, such as manure, etc. Obviously, both animal health and plant health burdens create impacts in terms of food safety and nutrition into the human health burden. That's the impact of the food system. You can have adequate food supply, business and employment, and produce high quality safe food. And we're looking at this through a gender equality lens, knowing that in many countries, the animals, different sectors of the animal system are looked after by women and children, and others by men. We also, with our friends at NVI, have been always aware that we need to look at agriculture as well. So feeding the world is not just going to come from crops and stuff like that, but also below water. And obviously all of this is encompassed within environmental health. So that's kind of an interesting thing thinking about how these things are connected. It doesn't really give you anything actionable in terms of what those things mean. So the next kind of stuff I look at is what are our actual overarching objectives for dealing with One Health? So economics, very broadly speaking, is looking at efficient allocation of scarce resources. But why do we do that? What's the point? Well, perhaps the idea of One Health and One Welfare can actually help us to understand what that key objective could look like. And in this book and subsequent group and organisation that's still going by Kate Roebuck on Big Data Economics, he defined this objective as a safe and just space of society using resources with a ceiling that prevents ecological degradation. And I quite like that. One of the things it does is it actually breaks down that image for me of a paradigm of a triad of animals, environment, and humans. I think kept animals are part of society, okay, and wildlife are part of the environment. And therefore, what we're looking at is an interaction between society and the environment we live in. By keeping animals, we're implicating them in society's impact on the environment. So, we're starting to think, what are these objectives? We're trying to create a social foundation, looking at all of those ideas within the centre of the circle, we're providing those for all people in that equitable way. But we're trying to do that within an ecological sphere without creating too many of those negative impacts or kind of impacts that we see on life alone. We're trying to create that safe space without emergency. So, what does that look like? There are lots of different projects we could imagine that start to help us move towards those objectives. I really like this diagram. It's a bit blurry, and it's from the Dutch Ministry of Agriculture, published a few years ago. Unfortunately, they haven't really pushed forward with this project, but I think it was quite a good one. Talking about circular agriculture, they were really pushing for the fact that they weren't going to feed any of their ruminants, so cattle, for example, any crops. They were going to graze them only. Okay, and then the crops are either used for the people, or the waste from crops going to further processing, and you're looking at the monographic, so you've got pigs, poultry, agriculture, for example, only eating waste products. Okay, they're not going to have any crop products. And that includes waste products that come from consumption by people. So what you're looking at here is a kind of a virtuous cycling of nutrients throughout the food system. So just an example of something actionable. So, I'm just going to change gear here and just have a bit of an explanation of farm level economics from a non-economist. Okay, so we spend money, we encourage investment on provision of a suitable environment to grow our animals. So that's the management and the environmental modification of the treatment. And this creates a baseline health state. Now, those animals are also subject to pathogens and hazards, okay? And that can cause direct health loss, which changes the state of those animals away from that baseline health. Okay, and we can influence that through provision of veterinary treatments, vaccines, biosecurity, for example. So there are different levels of expenditure put into the livestock system. And that creates an overall health state that can be measured in terms of economic productivity. And what do we need? We need surveillance to determine diseases and health outcomes. And so when I heard that DHIS2, the community, was starting to go into look into animal health surveillance, that's why I'm here interested in engage. So a couple of direct links here to investment, direct outcomes. So improvements in animal health, what improved efficiency of livestock production, better supply. In general, in economic terms, better supply reduces prices, products become more affordable and accessible to consumers, and they can reduce their food bills and have money for other things. So we have positive impacts on society. Let's just move on to the positive impact. If you improve animal health, you can also increase efficiency of livestock production and use fewer resources per unit of food produced, reducing costs on land, water, air, lowering the environmental footprint of farming, more sustainable production practices to support biodiversity, positive impact on the environment. Okay, so they're two very simple, direct outcomes for improved animal health. There are lots of indirect effects as well. Okay, within the government of our users, we have a human health team, which is in collaboration with the health metrics evaluation, we do GBADs, and also CNSARA, their burden disease unit in Belgium. Now, this is a bit complicated, but what they're really talking about is the areas that we're focusing on in terms of those next level effects are antimicrobial resistance, zoonoses, and nutrition. Okay, and to AMR, kind of negative connotations there. Nutrition, it can be very much a positive or a negative, depending on what we're talking about. So there's a complexity there. So I'm now going to talk about what we're not doing, okay? Because I think there's always a risk that we're going to try and do everything. This is something I took from the FAO livestock policy paper from several years ago, and I've started to use it quite a lot because I think it's really important to frame the fact that I don't think we can all do everything. We have to stick to our, what we're good at. So this is kind of three-legged story of improving policy decisions in animal health. One is about trying to explain the importance of protecting public goods and reducing public bads. Okay, so that's, we're all in it together. We're not all going to take from natural resources that's more than what the natural resources can provide, so our neighbour doesn't, so our neighbour suffers. So we have to work in the public interest, not just the private interest. So that's one thing we have to get through to people. The other one is ensuring that a cross-section society, including those marginalised, and that could be about people, but it could also be the animals, the environment that are marginalised. They all need to have representation and ownership of, representation in the decision-making process. And therefore, it's got a chance of becoming more equitable. And the third thing, I think, is what we're actually doing. The other two is what we like to think we can do, but we probably don't have any tools for it. What we're really envisaging is providing better information. Okay? So we want to put more information into that process so that those who are really good at those topics have more information to go on. So when talking to Kofi, Adam, and Jean-Paul a couple of weeks ago in preparation for this, there are other things that came up that I didn't want to put to one side. We're not doing it at the moment. There is certainly an economic kind of way to use economics to do this. So the economics of One Health should also cover this. Okay, so how do we coordinate, avoid duplication effort? And I like this phrase that I think we use mutualization of resources. And it's about value for money. We all know those with investors, this is something that's incredibly important for them. So I'm going to move into the last section of my presentation with some information about the program and what we've actually achieved to date. Because I want you to think about whether you want to be involved in the future. So we're using case studies over the last few years to test the methods. We've standardized these methods into a technical guide, and now we're getting to the phase where we're thinking about modular scope and implementation. So the other reason here is to learn from successful DHIS model, this distributed Christian public good, and think about whether that's the right route for us to go, or whether we want to go down a route where it's slightly more top down. And obviously part of that, underpinning all of that, is developing teams of highly motivated and skilled people so there's a future possible. So, the way in which we work in GBADs is left to right. The first thing we do is understand the population, we understand their value, and whether the value, how that value relates to the investment currently provided, and that gives you an idea about risk. Then we look at the loss envelope, so that's an idea of how much we're losing and how much we're spending with annual division. The next one across is this attribution step, which is saying, well, within that total envelope, what's actually attributable to the different divisions, and I'll go into that next. And then we use, this is all kind of farm level economics on the left. Okay, so that's a bit that I understand a bit more because I've been in business. It's about kind of profit and loss. This bit is where we really need the high level of economics. So we use partial equilibrium models to try and understand the impact of cost of sales. And I'll go into this now a little bit. So this loss envelope, what are we losing? It's comprised what we're losing to penalties and what we're spending to control. Okay, really important to include what we're spending as well, otherwise we don't get half the picture. So this net output can be leveraged to your profitability. So you look at it in the current disease system, the benchmark system where your disease is being reduced and you're in an improved situation, and an ideal situation where there's no disease at all. Okay, then why do you do that? Okay, so you could just compare the benchmark, so the current status of all the farmers against the top 10% producers. So that might be your attainable yield. So if you moved everybody up, all the farmers up to the next level to being the same as the top performing farmers, what would it look like then? How would you be contributing to the economy? Would you choose to the reason for the gap to attainable could be that the technologies that already exist and poor allocation of input. So you're not allocating the money in the right place, and that's more about coordination, application expenses. We really need to do this one to the not including the not as well. If we're going to describe policy corrections like research and planning. So these are the places that even the best farmers haven't gone yet, but ought to. Okay? So that's why we need to have that gap as well. And that's a description of the annual envelope. So the next thing you can do is you can break that envelope down into different causes. And this is one image describing outputs of changes of the annual impact of the different issues across different projects. So they're not directly comparable, but I want to show you them in this image anyway. So what we've got is a project we did in South Africa, where we looked at the impact of heat stress and respiratory disease and feedlot cattle. Okay, and there you can see on the right stack the annual impact on profitability in these days per kilo produced. In Denmark, we did this project on antimicrobial resistance, so we were looking at protein and diarrhea resistance antimicrobial that had, and in Ethiopia, we looked at mastitis and antibiotic resistance there. And these are the different profitability changes. Okay, and just remember, these profitability changes affect the way that animals use resources, and therefore then affects environmental sustainability, but it also can have an impact on the availability of nutrients for people, and also of antimicrobial resistance that can transfer to people. Now this is a bit small, but I just wanted to just explain to you the fact that when we're talking to policymakers and investors, it does help to amplify these up or changes into things like gross domestic product, and so the changes at that level that we can have in society. So that doesn't encompass everything there. So there's also, when we're looking at gross value of production, And that's more includes the intrinsic value in the supply chain, which is over and above just the value of the GDP. Okay? So you can see here, one of the things to just look at here is in the left-hand model, which is called a partial equilibrium model that we use in South Africa. This shows partial equilibrium models show the impact across the value chain. Okay? The economic impact across the value chain. Now, the interesting thing here, the middle column shows change in producer surplus, which is basically how much more money producers have to spend over what they're planning to spend on their goods, and change in consumer surplus. The change in consumer surplus is actually higher. So improvements across the livestock chain are actually benefiting the people who eat meat and consume animals more than people who farm it. So there is a clear societal benefit there. On the right here, we've got a general equilibrium model, and these are more suitable for countries that are heavily dependent on their livestock, and livestock are a big part, like Ethiopia. And you can see that there is a predicted rise in GDP by 2.5%. If you went to, if you just cut out mortality, if you went to the ideal health state, it's 2.5%. Now, obviously, that we're not going to get to those figures through an individual health intervention, but even just 0.5% of GDP, that's a huge amount of money. Just finishing up now. This is just a map of some of our case studies. Right? So we're not quite as, we're certainly not as advanced as DHIS2 in our network. We've got those 3 months that are completed in a mixture of high-income and low-income countries, and others that are ongoing. And we do this through a combination of working with governments, with research institutes, and through PhDs. There's multiple different funders, UK governments, after I've shown the last slide, the funders. There are lots more proposals that are ongoing. Very happy to talk with anybody here about whether you'd like to learn more and potentially get involved in the global environmental diseases as it pertains to One Health and improving the human health system. These are a patchwork of our collaborating organisations. At the top, you can see the funding. So we have work in Indonesia funded by the Australian government, work in Senegal funded by the Canadian government. The Irish government had a PhD, self-funding. Gates and UK are original funders. We have a project on working ethics and creative through the book, and CFAS, HDB, a UK institution funding work in the UK. And we've done work through FAO, and also that's been funded through NORAD as well. So we're working that. That's my last slide. I hope that's a little bit of time for some questions. But okay. Great, thank you very much, David. So likely this is where we pass the time of the session. In case, of course, anyone would like to make a question, I think the speaker will be more than happy to answer them. For one online, please, you can use the practice to any question, any follow-up, or to contact the different presenters. Well, all the presentation will be placed on the conference. So thinking about One Health for 1 hour, I think is almost impossible, as we showed today, because it's so broad, touching climate health, animal, environmental, a lot of sectors. It's something that, as you can see, I think is over the news in a daily basis. Take an example of the rise of prices of eggs in the US, for example. This is something that is concerning not only animal health, it's concerning economics, it's concerning human health. So it's something that well, in DHIS2, we heard examples from Togo, DRC, and Guinea. We heard example from Rwanda. We had other examples from Tanzania, Indonesia, and many other countries that are using DHIS2 on some aspects, maybe only animal health, or many other aspects, animal health as well, or now with the current health project is a huge component of that. So it's something that DHIS2 has been shown to be kind of well placed to be able to gather information from different systems and to analyze them together. So it's something that for sure we have more
in the future. In case you are interested, once again, the presenter, I think, will be more than happy. Yeah, maybe they will say here some of that, they will need coffee. And, but of course, as well, through the DHIS2 webpage, we are going to continue to publish any kind of success story or not, a success story about the user group. So thank you very much for your time and your attention. Thank you. Thanks, Stefano. Thank you very much.